Alright. Hi Jada, I'm Riley. It's
Hi,
nice to meet you. I'm going to be your exercise science professional today. Thank you for agreeing to come in. I'm going to be recording the session for part of the assignment. Is that okay?
Yeah, totally fine.
Alright, awesome. So let's get started. So before I start any assessments today, I'd like to get to know more about your history and your background health, just so I can design the most effective and safe program for you.
Sounds good.
Alright, so I see that you filled out these forms and you have marked some yeses to a lot of them. Would you be able to tell me what brings you in today?
Been having a lot of joint pain and some breathing problems associated with my POTS condition, postural orthostatic tachycardia syndrome, and my EDS symptoms as well, Ehlers-Danlos.
How long were you diagnosed ago with those?
About a year ago now. So
Okay.
I've had these symptoms for a while.
Alright, and what kinds of experiences have you had with those in this past year?
A lot of back pain, some leg pain. It honestly depends on the condition, but a lot of the joint pain comes from the EDS and a lot of the breathing pain comes from the POTS diagnosis.
Okay, so you said your hips and your back.
Mhm.
Have you noticed any patterns with any of these times of day? If you exercise and it brings up any of those pains? Notice any patterns after standing, after sitting, or even after like being out in the heat that you notice that you feel a little bit of this fatigue that I see, or this dizziness or nausea?
Definitely when I stand up. A lot of times if I stand up and walk a few steps, I can feel the dizziness a lot.
Okay.
When I'm doing a lot of physical activity, I can definitely feel it.
Mm-hmm.
If I'm doing like super extraneous and hard activities, definitely.
Okay. And do you have any electrolytes that you carry with you? And if so, how often do you take those?
I haven't recently, but I've been trying to get better at it with carrying like liquid IV, Gatorade, anything with salt, with a good salt or a composition to help bring up those electrolytes.
Okay.
Because with salt, because with POTS, salt is a really good thing to carry for those.
Yes. And then do you take any other medications for this, for EDS, for anything else? Okay, great. So I see here that you also have a little bit of like chest pain and shortness of breath. Is that just from the standing up and down, or is this from more the exercise related?
Honestly, it kind of just happens with my POTS diagnosis. Heart palpitations, shortness of breath can happen pretty much at any time.
Okay.
But I know generally it's either I need to sit down in order for it, or if it happens while I'm sitting down, I just need to lay down for a couple minutes, and it usually will
subside.
Yeah, subside and be done.
Have you had any fainting episodes?
No.
Never?
Mm-mm.
Okay. And when you were talking about your joints, have you had any dislocations? Is it pain that you feel, or is it more just that discomfort? Is there any, if it is pain, is it more like sharp, just aching?
It honestly depends on what I'm doing and like how much pressure I'm putting onto it. If I'm standing up for like, let's say 4 to 6 hours, then generally my back pain will get a lot of sharp pains.
Okay.
My hips will get some like dull pains to it.
Okay.
But if I'm doing like maybe even just standing in the shower, sometimes I'll get like knee pain and it'll be like sharp pain.
Okay.
So yeah, that's about where it goes.
Have you seen anybody about the pain?
Not necessarily about the pain, but I have seen people about the diagnosis.
Okay. And I'm assuming that you have done physical therapy for this?
Yes.
Okay. And how long ago did you do that?
I want to say the last time I went was about 2 months ago now.
Okay. And how often were you doing that?
I was doing it about twice a week.
Okay. And when you were there, what kind of exercises were you doing?
We were mainly focusing on core and back stability because that's where a lot of my problems kind of come from. So we were doing like a bunch of hip stretches, core exercises, and things like that to help build that stability and strength.
Okay. And during those movements, did you feel any discomfort that you were aware of and let him or her know?
Yeah, when it came to doing especially like the ones for my hips and legs, I did feel a lot of discomfort there, and I did let him know, and he was very understanding of it. And so we either didn't do as much of that exercise as we had planned, or we switched to another one altogether, and that, but like a less strenuous exercise similar to that one.
Okay. And since then, have you continued with any regimens from that or have begun any physical activity on your own? Okay. I see that you do walking though. Is that
Yes.
something that's pretty often?
Yeah, I travel a lot during the day, so walking's a big part of what I do during the day, so.
Okay. Good to know. And then it says that you've had some sort of limitations with your physical activities. Does that mean now or was that prior to doing your physical therapy?
Both.
Okay.
Like, it honestly depends on the workout or the exercise that I'm doing. It's still kind of the same amount of like limitations though. Like, I can't stand up for a long period of time. I can't do a whole lot of walking.
Okay.
I can't do a lot of like super serious physical activity. I can do it for a short amount of time, but I can't do it for long periods of time, if that makes sense.
Okay. Yes, of course. Okay. So what we will do here today is some assessments and we'll get kind of a baseline for where you are. And what would you say that your goals are for me? What would you like to get out of this? Short term, long term, even in today's session?
Just basically to build up some strength enough to like work up to the point where I can do more workouts, more exercises, or even just like not having as much limits to my daily activities, because like I want to get to the point where I can, you know, stand for longer periods of time and walk for longer periods of time instead of having to be like after 30 minutes I have to go sit down, because that can kind of get frustrating.
Yes, I understand.
Just doing like short like exercises that can help me build up to doing things long term.
Okay. And I do see that you have been diagnosed with anxiety and mood swings. Does that also contribute to motivation or anything with your goals? Okay.
Yeah, definitely the anxiety. But I've had a lot of help with managing it, so I can pretty much manage it well enough, but sometimes it does come into impact on how I do exercises and such.
Okay. And with that kinesiophobia or that fear of exercising, how does that play a role into what you want for your long-term goals?
It plays a role basically like I don't want to strain myself too much with my exercises. So like I want to do small things to push me to do bigger things, but I don't want to push myself so much to the point where I'm just like debilitating and that gets to the point where I'm like, this might not be a good idea for me anymore. But I know that with EDS and PODS, it's definitely more of a good idea to exercise than to not.
Yes.
So it's definitely a better idea for me to work up the short term to get to the long term rather than just not doing it at all.
Yes, sedentary behavior definitely adds to that for sure. So even if we could start you on a couple months worth, if that's like once or twice a week, or if we have to do any modifications, we definitely for sure can make that consistent. And then what are you currently feeling? Is there anything that brought you in here today or in the last week or anything just recently that has been aggravating more or just a constant?
No, everything's pretty good. I'm just wanting to see if I can, get back into it.
I see that it says you're not currently pregnant, but you have had a surgery.
Yes.
Was that for that miscarriage?
Yes.
Okay. And how long ago was that?
I want to say it was almost a month ago now.
Okay. And have you had any pain or discomfort or any issues from that?
For a couple days after the surgery, definitely, but after like a week, I was feeling perfectly fine. So.
Okay. And do you have any symptoms now or?
All good.
Good. And it seems like your family history, you've got a little bit of that hypertension and the heart disease. On what side of your family is that?
I think my mom's.
Okay. And it seems like there's no sudden death, but has that affected age or daily functional activities?
Sometimes in my older family members, definitely, but like not. I don't think any of my younger family members have had any of that happen.
Okay. And it seems also diabetes are on there as well. Anything psychological with anxiety or depression either?
Anxiety on my mom's side, but that's about it.
Okay. And any other family history or injuries you can recall? Surgeries? Okay. So as we had talked before, it seems like you do a little bit of walking. Is there anything else you do as far as resistance training or any other aerobic training?
Not really.
Okay. So that's definitely something I would like to work up with. Incorporating at least maybe twice a week with resistance training. And it'll be a couple months worth, you know, maybe 3 months. Just kind of depending on how you're feeling and how we can modify if needed.
Sounds good.
Okay. And based off that physical limitation, you did circle yes on this paper with that physical limitation. Was that only for a certain amount of time, or is that in general, and are you still seeing your primary care physician for that?
For physical limitations, generally, if I'm exercising for a long period of time, then I have that physical limitation. But if I'm just doing it for a short amount of time, then I should be fine.
Okay.
My medical provider, I don't really think I've really said anything to her necessarily about it.
Okay.
But she's aware of my diagnosis.
Okay. All right. Well, I think that is all the questions that I have for you today. So thank you so much for coming in, and I look forward to working with you and seeing you again.
Thank you so much.
I believe my assessment tool captured most everything that it needed to have. It had the ROS, family history, current medical symptoms, and a couple of other things. I believe as far as clarity, there was only 1 to 2 questions that she had needed answered. For example, BMI, she did not know what that was, so I clarified that that was something on my end that we would later do as a personal trainer. Relevance, I think it was the right information, again, for her needs and symptoms for her POTS and EDS. I believe efficiency, it wasn't too long or too short. It was about a 5 to 10 minute intervention before we began with the actual assessment. As a trainer, it was easy to take notes and refer back to so that I could answer questions, follow-up questions, based on her condition and previous answers, and she was very engaged with it as well. As far as 3 things that I think that I did well on was asking those follow-up questions about timing and referrals. So she did mention she had pain, so I asked if she was seeing anybody about that. I don't think that I was redundant as far as the questions that I was asking. I think they were pretty self-explanatory, and I was hitting what I needed to hit. I think the client felt comfortable sharing some more like personal information. I think I was good about empathy and being understanding of her condition. Tailoring questions to her background, I think I also did well on. However, that could use some improvement for the next 2 clients that I have. I just think that I hesitated to answer the questions in the order that they needed to be answered. So that's something that needs to be worked on, so that's part of something I did not do well on. I was also not very confident. This was my first one, so going through it, I had a harder time with trying to get everything in and under a good time, about 15 minutes, which I hit that right, but I think there could be improvement with that. I was just a little bit nervous, so my words just got a little bit jumbled when I was trying to explain something or ask another follow-up question. I also believe that I missed a lot of the stuff that she circled. I got the main majority, like red flags and things that were pertinent to her. However, there should have been other medical family diagnoses. Recently, one of her family members had a stroke, and I missed that. I did hit diabetes, but pertaining to her, I missed some cardiovascular, like palpitations or other respiratory issues that she has regarding exercise and physical activity that she has done. Even with her physical therapy, I think I could have been more... I could have asked a little bit more about what she was doing to get a better understanding of why she had stopped, or what could have aggravated her symptoms more, or how that helped or how it didn't help. For the next client, I plan to have it a little bit more organized. I think there was a lot in my head going on, so I wasn't very aware of the order in which to do it. I had missed goals. Goals should have been second, and I did that more towards the very end. So for next time, I will make sure that I have more of that clear line of thought. And then as far as the 6 lines of thought for psychosocial, I think the patient expressed that her physical activity was lacking and that she would definitely benefit from training, and it would help her progress to where she wants to be long term. She also expressed that it is hard for her to exercise, so maybe she has a little bit of exercise intolerance built up from her EDS and POTS, given the other symptoms that she has, such as wheezing or shortness of breath. I also think that from standing and sitting, and also like more intense movement patterns, that could contribute to it as well. Her kinesiophobia, marked in the Tampa scale, also could affect her motivation and her adherence to the program. I think that fear of injuring herself or continuously being in pain could back that down. This definitely affects how she wants to continue, since she said that she was not doing her physical therapy regimen. She had just stopped it altogether, but also that could have been from her doctor expressing that she should not do anything given her miscarriage. For some assessments I would perform, definitely some joint stability. She mentioned that there was a lot of abdominal and lower back pain that she was experiencing, and so that was very heavily focused on during her time in physical therapy. So I would definitely do some light resistance in different planes, using also stability devices as a ball or a medicine ball or perturbation training to get her both bilateral and unilateral testing. During her time there, she also expressed that she had focused on hip pain and knee pain, and she did some overall functional mobility assessments with that. I would also test her hip and knee range of motion with a goniometer, and possibly use the Berg balance scale for functional balance to compare her values to norm values. I would also assess her balance utilizing the STAR excursion test or proprioception with a foam block, and she would stand on it with her eyes closed. For the dizziness, palpitations, and shortness of breath that she was experiencing, I think that maybe a 6 to 10 minute, depending on how she was feeling that day. It could be modified, like a stand test would be good to monitor her heart rate and blood pressure, since it elevates extremely quickly. I think also it would be important to test an overhead squat assessment, modified again depending on how she was feeling that day and how her joints are. I think also a Thomas test for hip flexibility would be important, since she mentioned a lot of her discomfort comes from that. And then something that's also important and significant to continuously monitor is her RPE during exercises, her pain scale from 0 to 10, how she's feeling that day or even during exercise, and then just symptoms if anything comes up during our training session. And then for diagnosis, she was diagnosed with POTS and EDS by her medical care provider. However, I do think that instability, weakness, and pain is definitely prominent in specific movement patterns. So especially her lower back pain that was focused on a lot during her physical therapy, and her weak abdominals, I feel like that could also cause compensations for that pain in the hip and the knees. For her prognosis, I think slow recovery is important, with her adherence to the program over the next couple of months. So maybe 2 to 3 months would be good for her, since she is a little bit slower on that end and it can become debilitating for her. And since PT was helping, but she had to give that a pause for her miscarriage, tracking that consistency, her energy levels, symptoms, flares is definitely important for that long-term goal. And then as far as interventions, it is crucial to educate her on modifications that she can do or the exercises that she's doing and why they are important. A lot of informed trial and error with intensity, joint stability with the exercises, and understanding if her symptoms are consistent or if they're decreasing or if they're increasing is very important to this. I've said that a lot. And then as far as outcomes, we just want to measure her change over time. So is her tolerance improved or is it not? Has her stability improved or has it not? Are her symptoms still as severe as they were coming in to this training? And then more of that like subjective improvement as well is it becoming easier? Is she sleeping better? Is she getting stronger? Just that functional motility and movement for quality of life.
Hi James, it's nice to meet you. My name is Riley. I'm going to be your exercise science professional today. But thank you for agreeing to meet with me. Before we begin, do you have any questions and do I have permission to record our session today?
Yes, you do. No questions.
Alright. So before we begin with any assessments, I would like to get to know you and your medical history just a little bit more as well as your goals. This would help me design the most effective and safe program for your needs. So I see that you have filled out these forms and you checked certain boxes. Can you tell me more about what your goals would be, where you would like to see yourself in 2 to 3 months' time or even a year from now?
Fully retired. Being able to play golf again. Be able to work out with little to no discomfort or pain, lose about 30 pounds, and that's about it.
Okay, so I see before we get into that you are currently taking high blood pressure medication and cholesterol medication. How long have you been taking those?
About 30 years.
And how often daily do you take those?
Once a day.
I also see that you've had 4 shoulder surgeries, dislocations, broken bones, tendonitis, and some other issues. How long ago were those surgeries?
The 4 shoulder surgeries were within the past 10 years.
And how about the dislocations?
They were mainly during high school and college, quite a long time ago.
Okay. And were you able to go to PT for those?
Yes, I was.
And how long was your time there?
Actually, about 4 to 6 weeks, if I remember correctly.
Okay. And then how often weekly did you go?
Started off being about 3 times a week, then decreased to 2, then decreased to 1.
All right. And then as far as conditions, I see that you have marked arthritis. Do you have any discomfort or pain with that?
I have discomfort in my shoulders, yes.
Okay. Have you seen your doctor about that?
I have. I get cortisone shots about every 4 to 6 months.
Okay. All right. And then I see that you're pretty physically active about 3 to 4 times per week, doing both aerobic and endurance training. I see for aerobic, it's a lot of biking or just walking. And for resistance training, what does a typical session look like for you?
Basically, just when I don't have elbow tendonitis, I'm able to use the machines in the gym, and I do a full body workout, head to toe. Or at home, I use rubber bands, stretches, the TRX system, and dumbbells.
All right. And then how often do you train that per week?
I try 2 to 3 times a week.
Is there anything as far as the exercises that you do that aggravates some of that tendonitis pain that you feel?
as far as my shoulders,
Mm-hmm.
any overhead type things where I push up,
Okay.
coming much just when I go up.
Okay. And can you describe that pain? Does it feel more dull, achy, sharp?
Mainly just achy.
Okay. Is that every time that you work out, or just specific times when those flares happen?
I would say the majority of the time I work out,
Okay.
caused by arthritis, but I have. Oops.
I'm sorry, could you repeat that?
I think a lot is caused by arthritis in my shoulders.
Okay. Alright. I see that you also have marked down some kinesiophobia in regards to exercise. That's like a fear of working out. However, it doesn't seem like any of that psychosocial or mental blocks discourage you, which is great. So, as far as today, is there anything that brought you in with your current medical symptoms, like that pain, that you just wanted to get feeling better with?
Just basically my shoulders ache all the time, and now I'm suffering from elbow tendonitis. That's severe. I'd like to see what we can do about that.
Okay. And did that elbow tendonitis really start more recently? Has that been, you think, a compensation for some of that shoulder pain that you were feeling?
Could be. It's been going on since last fall when I started to play a lot of golf, combined working out.
And have you seen anybody about that as well?
I've had shots in my elbow. I've had an MRI and an ultrasound, and I'm going in for a procedure next Friday called tendinova, where
Okay.
at my elbow area, and also get a PRP shot injection, which is the stem cell blood.
Okay. Alright. And then I see, as far as your past medical history, that you've got some family disease of diabetes and heart conditions. What kind of, do they feel anything with that? Does that limit their current exercise status?
You mean my parents who've had that, or me?
Family history, so your parents and what side that is on.
It's on both my mother's side and my father's side. Heart disease and diabetes is more on my father's side.
Okay. Do you know if that limits their current exercise that they would be performing?
For my father, it did.
Okay.
There are.
Okay. All right. Well, I appreciate your time and coming in. And for the next 2 to 3 months, I'd like to work on some of that shoulder instability. However, since you are feeling pain, I would like to refer to your doctor. And then once you get that diagnosis, then you can come back and we can figure that out. But for the time being, I'd like to focus on that shoulder instability and that weakness to get you back into reaching your goals in about that time session. And then in the meantime, if you have any questions, please let me know, and I look forward to seeing you again soon.
Thank you, Ms. Riley.
All right,
I look forward to seeing you.
Thank you.
Have a good day.
So this was my second client, and I think that my confidence definitely improved, but it could have been better. There was some hesitation, especially at the beginning, and some other questions that were asked along the way. I think, though, overall, it was easy to understand, easier for clarification, easy for questions to be asked and to be answered. And then going into the psychosocial aspect, the patient did not express any fear as far as working out, that kinesiophobia, since he does work out 3 to 4 times per week, incorporating both aerobic and resistance training. However, that pain and discomfort can sometimes lead him to not wanting to exercise or could limit that physical activity. The patient did mention that the pain resides mainly in the shoulders and the elbow. I should have asked which elbow to clarify so that I could begin my regimen. So I knew which one to do and to assess. And then that was mainly observed when performing overhead or pushing moments, but it's more of an ache rather than a sharp sensation. As far as assessments, I would perform just a baseline overhead squat. This could be modified if needed, but I think to see if there are any movement impairments or compensations that the overhead squat could be painful, but I would assess if there was any anterior or posterior pelvic tilt, if there was any excessive forward lean of the trunk or the neck, or if range of motion is limited in his shoulders or elbow. I would also like to assess for elbow flexibility and range of motion with the elbow extension assessment. So I would have my client lying prone or on his back, and I would assess if there was any weakness in the muscles or short muscles that could compromise his full range of motion. And then I would also assess for shoulder internal and external rotation, given that he plays golf a lot of the week. I think it's twice a week. I should have clarified, but I know that. So, in that golf swing, where in his shoulders, and what shoulder. Yes, that was a big part that I think that I missed that I could have improved on. If there was any of that instability or pain, where it resides, and if there's muscle imbalances. And then since the client is undergoing a procedure this coming Friday, these assessments would have to be pushed back until the patient is recovered. As far as the diagnosis, the patient has been diagnosed with by a medical provider with elbow tendonitis and undergoing that procedure. Since pain is present, that referral would need to be best at this point in time. And then while the patient is recovering and feeling like he is able to come in, we can take those best baseline measures. For prognosis, the patient went to physical therapy. However, that pain and discomfort is still there. Thus, that recovery and adherence to that structured program in the next 2 to 3 months would be best. It would be important to start slow and progress based on the patient's needs and modification, while also tracking consistency, energy levels, and if symptoms flare. For interventions, education is important, avoiding activities that limit that, or even that trial and error method with flexibility, mobility, and range of motion. Training intensity is also important to see how the patient is feeling that particular day. So if they're coming in with a little bit more pain, maybe we'd modify and change some things that I had set up for that day. We would also look for joint stability with their exercise, and progression can be made if they were feeling good, or regression if they were not feeling good. And then just consistently monitoring their symptoms, if it persists or it decreases, for outcomes. And then, we would retest range of motion and see if anything has improved, and if it has, we can keep going from there. If it hasn't, maybe we spend a little bit more time in that section and seeing if there's anything that I had missed, or if there was anything that maybe we could keep working on before moving to something else. And then 3 things or more that I feel I did well on was, I feel like I was definitely more prepared and organized. I was able to answer questions and jot down some of that important information. With the last one that I did, I think I was so focused more about trying to get questions answered rather than listening and taking the time to write it down so that I could ask follow-up questions that were appropriate. I think this time I went more in order, with goals being that second thing. I think in the last one, it was more towards the end, and it should have been one of the first after demographics. I did well with noting that a referral should have been made because of that pain. And then, as I had mentioned earlier, my confidence was better, but still very hesitant. So some things that I think could be improved is stuttering when I'm asking those follow-up questions. I missed some important information regarding stuff that I had said at the beginning that I would circle back to, and I didn't. I forget what it was, but and then a couple other little things, like I missed the intensity of the workout. That should have been noted. I was a little lost on like the current symptoms because I focused a lot on more of that past medical history than what the patient had come in with for me to know. And then I think the biggest thing that I struggled with and realized after was that I did not get a lot of his review of systems. It was a big indicator of his needs. However, little was marked or checked off except for that fatigue and joint pain, which was said earlier. However, that fatigue should have been addressed to know if it was ongoing or if it was every once in a while, and how that can affect his exercise program, and if it's currently affecting him coming in or the exercises that he is doing during the week. For my last client, I think being a little bit more prepared than I was for this one and addressing that review symptoms along with the goals more towards the beginning will help me stay more organized and more efficient with everything that needs to be covered.
Hi Megan, it's nice to meet you. I'm Riley. I'm going to be your exercise science professional today. Thank you for agreeing to come in today. Before we get started, do you have any questions? Is it all right if I record our session?
Yeah, it's okay to record.
Okay, awesome. So before we begin with any assessments, I'd like to get to know your background and goals a little bit more. This just helps me design the most effective and safe training program for your needs. So is there any activities you specifically want to train for?
No, not really.
Okay. Is there any type of movements like squatting, jumping, running that you would like to improve?
I want to improve my squatting
All right.
and running.
Okay. Like more like that form aspect of it.
Mhm.
Okay. All right, great. So as a personal trainer, I hope that I can get you to your goals in about a 2 to 3 month time frame. And then I see that you have filled out this form and you've marked some anxiety. When do you tend to experience that most? Is that related to the gym or other like personal matters?
I feel like it's personal matters.
All right. More like school and everything that's just going on. Okay.
Definitely, yeah.
All right. And I also see here that you experience some headaches and mood swings. Can you tell me more about that? Is it a specific time of day, in the month?
I feel like when I'm feeling anxious, that's when I experience the headaches. But when I'm like, okay, then I don't really experience headaches like that.
Okay.
Then.
All right. And then I also see that you have a couple of marks as far as history of injuries. So I see that you have had an ACL tear. Did you get surgery for that?
Yeah, I did.
Okay. And how long ago was that?
That was 5 years ago now.
All right. And I see that you're not taking any medication. Is there any other medication that you're taking aside from that?
No.
Okay. And then did you have a full rehabilitation program afterwards?
Yes, I did.
Okay. And then how long was that program for?
I'd say about 8.5 months.
Wow, okay. Can you recall any complications after your surgery?
No, honestly,
Okay.
the process was pretty good. I was
Alright.
able to get back to like full range of motion
Okay.
pretty soon after.
Okay. And then how often were you going to physical therapy throughout the week?
Ooh. 2 or 3 times a week, I think.
Okay. And then if you can recall, what type of exercises were you doing? Was it more like strength-based? Was it more of that flexibility, or kind of a combination of everything?
Definitely a combination of everything.
All right. And then have you had any other injuries to that knee or to the other one since?
No, I haven't.
Okay. And then I see that you are very physically active, working about
4 to 5 times per week. You do a lot of resistance training. What does a typical session look like for you?
I usually go to the gym and I spend around 2 hours there. It varies, like I change my like split in the days of what muscle group I'm training. So I tend to do weight training for like an hour and a half, and the last like 30 or 20 minutes I'll like do cardio.
Okay. And then is that the only time that you do cardio, or you do any other like aerobic activity throughout the week?
Yeah, unless I like go for a walk or something.
Okay. And then it seems that you do pretty heavy resistance training on certain days. Is there any instability that you feel in your knee or like weakness with that when you do like squats or running, as you had mentioned earlier?
Yeah, maybe sometimes when I do like Bulgarian split squats, I feel like pressure in my knee, but it's just like in the moment, and then I like.
Okay. So nothing afterwards, like no pain, discomfort?
No.
Okay. Have you ever experienced pain doing that after your injury, or?
Maybe in the beginning, because I didn't get used to it, but once I built my way back to, then it was fine. Yeah.
Okay. And then I'm assuming you feel pretty confident in those higher intensity activities. All right. And then have you had any issues with flexibility or noticed any like changes or imbalances between your left or right side?
No, I haven't.
Okay. So you feel like you got that full range of motion back?
Yeah,
All
I
right.
did. Yeah.
That's good. Good. And then, do you currently perform any like strength training or balance work for your knee, or is it more just that resistance training that you do weekly?
The resistance training I do weekly.
Okay. So maybe that's something we could just work on, is, you know, some of that strength work specifically for the knee, since you do feel that instability, and then we work on that for like a couple months depending on how you're feeling, and we can progress or regress depending on that. And then, is there anything as far as symptoms that brought you in today, like pain or again that discomfort, that I should know about?
The discomfort is what brought me in.
Okay. And is that after resistance training? I know you said that sometimes it's more during that time, but anytime afterwards when you feel that discomfort, is it with certain movements like pivoting or walking that kind of aches?
Especially when I'm like doing like pivot movements or jumping, I notice like more discomfort. Yeah.
All right. And then, are there any movements that you're kind of hesitant to perform because of that discomfort?
Yeah, the like pivoting, I try to avoid it.
Okay. So that's definitely something I think we should work on. And it doesn't seem like you have any mental blocks that discourage you, so that's really good. And it seems like as far as family history, there's nothing on diabetes or hypertension or heart disease, so that looks great. And yeah, so thank you so much for coming in today. I really appreciate your time. In the next 2 months, I hope to get you to where you want in your goals. And from then, if you have any questions, please feel free to reach out, and I will see you soon.
Thank you so much.
Yeah,
Thank you
of
for having
course.
me.
So this was my last client and my last self-assessment. I believe that there was a little bit more lack of information than I was able to go based off. There wasn't a whole lot of context as compared with my other 2 clients. There was a lot more as far as past and current medical history that I could ask questions about. However, I was still engaged and she was engaged, and I think that the questions were still clear for her to answer. As far as psychosocial, she did not express any fear regarding exercise, given that she does high physical activity 4 to 5 times per week, that being more resistance training than aerobic training, but still tries to incorporate that. As far as assessments, the first one I would perform is a static posture for malalignment. I would check for knee varus or valgus when performing squat. The second one I would do is knee sway, a single leg test with her eyes open, as she did mention that she has some weakness or some of that instability in her left knee during Bulgarian split squats. And then I would perform a step up on a 12-inch box to assess for compensation and where she feels some of that discomfort during her activity. For strength testing, I would want to do a wall sit to monitor her quadriceps endurance. I would also assess for glute bridge holds to observe her knee and hamstring control or hip control. And then I also believe it's important to test her balance and proprioception. Maybe a single leg with her eyes closed on a foam mat with her eyes closed to assess her balance with that, and even maybe a STAR excursion test. And then since she did mention that pivoting causes some discomfort, I think it would be best to avoid plyometrics and deep squats at the moment. And then for diagnosis, the patient was diagnosed by a medical provider with an ACL tear 5 years ago in her left knee. Since discomfort is a little bit present now, and it might not always be present during or after, it's still important to understand why it's happening and what specific movements cause it. For prognosis, she went through physical therapy for 8.5 months, but some recent discomfort occurs, so adherence to that program over the next 1 to 2 months would be best. The patient is very physically active, but again, avoiding those pivoting movements until some of that discomfort has subsided is important. As far as interventions, I think re-educating her on the types of activity that should be avoided is important to ensure flexibility and mobility, since she does have that good range of motion. And then if joint stability improves with exercise, progression can be made to work up to her goals as far as that squatting and running technique and those plyometric activities, since she did mention that jumping and pivoting does become painful at times. And then as far as outcomes, I think monitoring that discomfort, when and where, how often, and then as well as her anxiety and how the patient is feeling that day. So if she's a little bit more anxious, uneasy, has some headaches, as also discussed in her review of symptoms, maybe we could modify that day, and then just go from there. And then over time, I think we should retest and reassess and see if symptoms have decreased, increased, and if the client has progressed overall and they are feeling more strong. And then some things I think I did well on was, this was the one I felt most prepared for and organized and better following chronological order with asking the questions. I do think that I could have confused past medical history with pertinent history, but I think that I did that correctly in that order. I was less hesitant and nervous. However, I think there was still some stuttering with questions to ask for follow-up, since again, there wasn't a whole lot of context to go based off. My confidence was there, but still could be improved, especially for future reference. Though the client does struggle with some discomfort, it wasn't pain, so I thought that a referral was not needed, so I best handled meeting her goals and understanding her needs rather than that referral to a medical care provider before coming back in to see me. I don't believe I missed any important information in her review of systems or past medical history. As I had done with some other clients, I had missed some bigger important information that should have been discussed that I did realize for afterwards and discuss during my self-assessment. And then I was able to jot down the information that she was telling me, so I had an idea to begin for future assessments. Some things that I don't think I did well on was getting full clarity on her goals, and if there was anything she would like to focus on. It was kind of like very vague as far as what I did ask and what she did answer. So I think the only thing that was mentioned was more of that understanding of exercises and improving her running and squat technique. I think on this one, I looked down more at my computer than I did with the other ones, just trying to like either figure out what needed to be asked or trying to jot down that information. And then something that could have also been improved was I should have had a timeline for when the client would come in next. I don't think I had one for any of the 2 clients prior as well, so that would be important. I had just mentioned I hope to see them again soon, but did not give, okay, I will see you Thursday if it was a Monday, or just something that gave that exact timeline. And then as compared with the other 2 videos, I think most of the questions were pretty clear, but I could have been a little bit more empathetic. I think I was a little bit too serious, and I could have had a little bit more of that client engagement. I do think, though, they did discuss afterwards that they felt heard and listened to, even as they did jot down information and was asking them the questions. I believe that my hypotheses could have been formed a little bit more during the assessment rather than after and going through these self-assessments. And then as far as confidence, I think it definitely improved throughout each of the videos. My tone was well managed, but posture also could have been improved, just to give that little bit more of that like entertaining engagement with the clients and even overall environment setting.